Hey everyone! Recently, I met an interesting, doctor essentially, who is on this new journey, which fascinated me because, there's few things that coincided with what I'm also doing, as business wise, or at least my side hustle wise, and where healthcare system is going. But anyway, I'll let him get into that. Well, Stephen or Dr. Stephen, could
Yeah,
you
it's
kind
fine.
of share who you are, your little bit of history to what you were doing till now to what you're planning to do for the future? So,
You bet, Roger. Thank you for your interest in my story, and thanks for your time and allowing me speak to your audience. It's a pleasure to be here. So, my name is Dr. Stephen Lewellis. I am a board certified dermatologist by training. I'll take you back a little bit in that regard. I grew up in Pennsylvania originally. I went to a small college there called Haverford College and then moved on to New York University for both my MD and PhD training. It was a medical scientist training program. That's where I met my wife, who's from Wisconsin, where we live now, but we met in New York. And then I moved on from there to 1 year in Utah for an internship, but then Stanford for my dermatology training. Now I'm in Wisconsin. There was a brief stint for about 2 years in Minneapolis, Minnesota, where I practiced first as a dermatologist. And then I've been here for the about 2 years and change since then.
mhm.
There's been a rather abrupt change in my life recently where I was employed by a large hospital system as a dermatologist. And one day they just kind of dropped the hammer on me and said, "We're not extending your contract. And today was your last day in clinic." And it was totally a without cause termination. They just no longer wanted to deal with me. And I suspect that was because I was just a bit of a thorn in their side in terms of advocating for physicians and patients and patient experience and all of those type of things that big hospital systems may not want to pay as much attention to. So it's a blessing in disguise that launched me into what I'm doing right now, which is launching a direct care dermatology practice, which just means we taking out the middleman, the biggest middleman, which is health insurance companies. And I want to renew and revitalize the relationship between doctor and patient. A lot of other people are doing this right now, but it doesn't seem like a huge thing. I think in about 5 years, it will seem like a big thing, and it will finally start making a tipping point where these big hospital systems have to actually respond to it, respond to physicians taking back leadership roles like this and becoming once again in charge of the physician-patient relationship. And I want to connect with all sorts of people in that space, as well as patients who are interested in that sort of thing, and learn from people like you and anyone else I can connect with.
Awesome. So what I mean, I'll share my own personal experience with Dr. We talked about it, Doctor and I talked about it before. So I shared recently a post where most clinics, hospital systems charge 450% to 470% over actually what they're supposed to charge.
Yeah.
And this is why for example, I use a nonprofit healthcare organization who goes in and cuts those costs. That's why most of the big hospital systems don't like that. Mm-hmm. And same with health insurance. They are now, right now, I just shared, Dr. Lewis, I don't know if you had a chance, Wall Street Journal is saying it's going to be the biggest spike in health insurance costs in a decade, more than a decade, coming soon. So
it's ridiculous.
It's incredible. So what doctor is saying, that's exactly what's going on. And that's what, that's when he talked to me about it. I'm like, oh, this is, kind of the reality. Not too many people realize, doctors realize, because as he's sharing, because he was questioning people, that's when he got, obviously their doctor system, that's the clinic system didn't like it,
Yeah.
he was being too questionable. All right, great, doctor. So you kind of shared like who you're trying to connect. So get into that, like, you're trying to create an educational system for people like you, doctors like you, who are fed up about the whole bureaucracy, whatever,
Yes.
the whole system. So kind of share what you're trying to do there. You're trying to create a YouTube channel to educate people to come along the journey with you. Could you share that information?
Absolutely. So, along with building my own practice from the ground up, which is what I'm in the middle of right now, the practice hasn't launched yet. I'm hoping for a January 2024 launch. We'll see if that happens. A lot of things are working in parallel right now since my transition into entrepreneurship was rather sudden. So just things are just getting rolling. But as I'm building that, I know I'm learning a ton. I'm trying things. Some things work, some things don't, and I'm iterating. And all of that that's happening in real time, I know is going to be of value to other people who are eventually going to want to go a route like this, or might already be doing it and want to see someone else doing it, or learn from each other. So I don't want to let that go uncaptured. So I'm also documenting my journey throughout. And part of that is going to be the launching of what's called the Direct Care Derm podcast. That's going to be my first podcast, launching also in January of 2024, in which I'll be doing solo episodes about my journey. You know, what is direct care? How am I building it? What technology platforms am I using? How am I differentiating my product from what someone would get from an insurance-based product, for instance? And there'll also be interview episodes in which I interview people all along the spectrum, from just contemplating this change. You know, they're feeling a little frustrated in their job. They're heard about direct care, but not really sure what it is, all the way to people who are way ahead of me, have full-fledged direct care practices. They're successful, or maybe even they've done that and they've retired and they just are willing to give us some information. So that, I think, will be valuable now, but even more so in the future, as more and more people discover this space and discover that it's an option for, if you're feeling burned out, you're feeling disillusioned, disenchanted with medicine in general, rather than leaving it entirely and doing something else. This is a way where doctors can find a way to thrive again within the what they trained so hard and so long to do and made so many sacrifices for. And that is the main way I'm going to be trying to educate my colleagues. And then I will also want to educate patients. Patients need to know about this type of service that we can offer. And it's my job to reach them and find them. So I want to connect with patients as well. I'd love to have a patient-facing podcast as well eventually, where I'm educating people about general dermatology things, also the direct care model, and potentially even have patients who have had a satisfactory experience with my product even come on the show and tell their experience and talk about what they were struggling with before model contributed to their transformation of their disease. And I think that would be tremendous in helping reach other patients.
Great. Awesome. I'll ask a two-part question here, doctor. So the first part is, can I, get into maybe brief description of the model for people who are not familiar with it? Just give a brief description. The second part of the question is, at what point, what triggered you to ask the questions you were asking? You don't have to get into details on that. Basically, what got you to think about, wait, what is this going on that these hospitals are doing that got you to question them, which led to, the rest of the stuff. But anyway, the first part, obviously, if you can share a little bit on what's the direct model and how the patients can benefit.
Absolutely. So the direct care model is simply bringing the physician-patient relationship back to where it started. Essentially, it used to be you would, quote unquote, hang a shingle as a physician, and a patient would come to you, and they would, just like you were at a grocery store, or you were at an attorney, or you were at a bank, or something like that. There was a service, and it was transparent what that service cost, and you paid for that service upfront. And the relationship is directly between the physician and the patient, and the prices are transparent. I think a lot of patients are frustrated about a few things. The cost of healthcare, despite having health insurance, they're still paying out of pocket tremendous amounts of money every year, and that goes up every year. Deductibles, copays, coinsurances, so they feel like they're getting it on both ends. And they also struggle with access, especially to see a dermatologist. It might be 3, 4, 5, 6 months that you have to wait to see a dermatologist. In a direct care practice like mine, it would focus on seeing a smaller cohort of patients who really need a higher level of care or more time, something like that. And because it's not going to be so many people looking for that, you're going to be able to get the appointment within a week or so. So that's an important part as well. And also, a small practice like this can really take advantage of the technology that is already out there, but large practices are so slow to adapt to. doctors are always the latest adopters. I don't want to be made fun of anymore for still using fax machines. It's an old joke. There are reasons that we use them, but regardless, there are so many things that are exciting right now that we can involve in our practices. And I think there are people out there who want that and they value that and they say, oh, okay, that's how much it costs. I'll consider that. And if they don't have a good experience, they move on. But if they love it, they tell their friends. And that's what I want to cultivate. I want patients who value me, and then I am going to value them. And if we are like valued rather than necessarily like-minded, if we're open-minded and like valued, then we are going to have a mutually beneficial relationship. I won't burn out because I'm not just trying to see a high volume of patients. I'm seeing a low volume of patients in a very fulfilling way. They are getting good results. So they are coming back to me, telling their friends and family, et cetera. And all is very transparent and there's no third parties. That's the beauty of it. So I think that people are more and more wanting this because of frustration on both sides. The doctors are frustrated. The patients are frustrated. It's not our fault, but it's our responsibility to solve it as doctors.
Awesome. Yeah. The second part where
yes.
Briefly,
yes.
What triggered you
Thank
to
you.
start questioning, the
absolutely.
hospital?
So when I graduated residency, all I wanted to do was just get a job because that's all I really heard about it. I didn't have any good examples, any good role models of people in private practice. I heard a lot of it's so hard to start a private practice right now. Insurance this, reimbursements that. It's just getting harder and harder. It's not like it used to be. So of course I would just slotted right into a job. I wanted a steady income. There was a lot of delayed gratification. I wanted my family to sort of start reaping some rewards finally. And I also wanted to learn how to become a good dermatologist. I didn't feel like I had the bandwidth to start and operate a business and learn how to be a really good dermatologist on my own after residency. So after 2 or 3 years of that, I felt good about that part. I was good there. I had bandwidth to start paying attention to other things. So once my mind opened to these other things, I started saying, hey, why are we doing things like this? Or why? I'm asking this question, why is it taking so long to get a response? Or these various types of things, or just getting very frustrated with when the insurance company is pushing back against me. And I know that I'm doing the right thing, but I'm feeling like most of my day I'm working for the insurance company because ultimately they're the ones reimbursing us. But I'm doing unpaid labor on behalf of those insurance companies in order for them to reduce their costs. So all of these things add up for a lot of doctors. They feel this sense of burnout, this sense of moral injury, but they don't often feel agency that they can change it. And for me, I was sort of pushed out of the nest early with that unique situation that happened. But the questions were there, and the questions are there for a lot of people. It's just a matter of some people have the mindset that I can change this. Some people have the mindset that this is just the way it is. It's killing me, but there's no other option. And I'm trying to be part of that, the wave of people who say, no, there is another way. And it doesn't mean taking advantage of patients. It doesn't mean only taking care of people who have tons of money. It just means providing a service that is transparent at a reasonable cost, because there's not all of these other aspects involved. Tons of third parties all trying to take their share. And just like every other industry, it's not only rich people who use lawyers, right? But lawyers are expensive.
Right.
And we are professionals just like others. We train a long time. We need to value ourselves, but that doesn't mean concierge. That doesn't mean only serving a certain set of people. But yeah, that's where those questions came from. I know I'm not the only one who has them, but the more and more of us who become leaders in this space and actually try to make a change, and communities are really important for that. That's why I love talking to people like you. We don't all have to be, it shouldn't just be doctors talking to doctors too, right? If doctors are just in the doctor's lounge complaining to each other, that is not helpful either, because it is no one's going to care about us if we're just talking to each other.
Right. That's great. That's great. Awesome. Well, I see where you're inspired right now, but I'll let you kind of, share. I mean, you got the journey ahead and all that stuff. So I'm assuming that's what inspires you to get up and do what you do every day. But difficult days will come, obviously, with your own business and all that stuff. So what do you think would be the inspiration to keep going for you?
So the inspiration, when people ask me about things like about that question, I go back to why. You can think of Simon Sinek's Start With Why, or just a lot of people, once they get into spaces like this, they always say, remember your why, because this is a hard road. Being an employee is good for a lot of reasons. It can be fairly straightforward. You have a steady income, but then you have all these other things that you start asking questions, but you don't have much agency over those questions. So once you choose the sort of freer road, you have a lot of bumps in the road. And someone made a very nice reframe for me. Her name is Dr. Ash, and she also runs a direct care practice. It's a direct care pediatric dermatology practice. She's wonderful. And she said, I was talking to her about a bump in the road, and I was just going to keep moving on and moving forward, and I'm going to figure it out. And she said, or as my husband's boss said, that's just the road. And as entrepreneurs, that's the road. We know that it's going to be hard, but you're just, a new problem comes up, you solve it. And if you expect problems to come up rather than be surprised by them, you can keep going. But also, if you have that why, for me, it's my family, my wife and my kids. I want to help patients, but I also want to have time with them, and I want to have quality time, not time where I'm thinking about I need to finish those charts, or that I was so behind in clinic today, and that sort of thing. So I want to build up that quality time with my family. And I also want to be a change in a medical culture that I grew up meaning medical school and residency, in a very pessimistic culture. And I think it's actually a really exciting time to be a doctor if you are willing to innovate and excited to innovate and willing to be creative and take chances, because there's so much tension in the industry right now, and it's ripe for disruption, but there's a lot of big players involved, so there's a lot of resistance to that. So that's also my why, just knowing that there's so much opportunity here, and I want to be happy being a doctor. I know I can be. I've had glimpses of that in my previous jobs when I'm just connecting with a patient, really helping them. But then I look at the clock and I say, oh, it's at 45 minutes into my 15-minute appointment, and now everyone else is behind. There's a bunch of angry people in the waiting room, and my whole day is wrecked. So those are my whys. That motivates me. It's just really exciting to be an entrepreneur and be able to help people build something, but also connect with people like yourself and build all these new relationships.
Awesome. That was pretty inspiring. No, yeah, I can see where the inspiration comes, Doctor. That's awesome. Yeah, what you shared. Well, you're on to the journey. I mean, you obviously, being a doctor is not easy. It takes a long journey. So
Thank you.
You shared books, all that stuff. So I'm sure you have a lot of tips and tricks, but you got to only share one that has helped you.
Yes.
And maybe helps others, whatever the case is. It can be professional, personal, whatever. So what's the one tip you want to share?
I would say this is a professional and personal one. I have, and it holds a special place in my heart, because it's one of the last, it may have been the last one, but it's at least one of the last books that my eldest brother, Jim, who passed away about a little more than a year ago, recommended to me. And it's by Marshall Goldsmith. You may know him. It's called What Got You Here Won't Get You There. And it's for people like me. I have used certain tools to get very far in life, quote unquote, get far, be successful, get the gold stars that you need to, get into a good college, get into medical school, get the residency, be chief resident or whatever. I wasn't chief resident, but that type of thing, and then get the job or start all of these things. But once you get past that and you're at the point where you are now supposed to be the leader and you need to be building something, all those skills you learn to get there aren't going to get you there. You have to learn a whole new set of skills, and you have to recognize the things that you are using over and over again that are no longer helping you, and they are actually hurting you to some degree. And there's a very defined set of things, maybe 20 or so, that people do 2 or 3 of these things that work against them once they get to this getting their stage of their life. And they need to recognize that those things worked for a while, but at this new part of your life, they're no longer working, and you need to choose different tools, and you need to develop those different tools. And all of that just starts with awareness and having the humility to be open to, oh yeah, what I did up till now, maybe I'm getting some roadblocks because I'm still using those tools and relying on them, and they're not the tools that are going to work for this stage. So certainly personal thing that makes me always think of that, but also it just was a really good time for me to hear that, because I didn't think nearly enough about that and do the work. And things like therapy and all kinds of things can help you recognize that, but even just reading a book like that can trigger or can spark something.
Awesome. Well, actually, I think you gave it two for there, but
Great.
one is, expect problems,
Yeah, true.
That's always going to be there. And then what, basically the whole concept of what got you here won't get you there. That's an amazing, tip for anybody. Even if you're in a job, it's the same thing.
Yes, no doubt.
To hire, it's not going to happen if you're just going to do the same things.
You're right.
Great tip, doctor. Again, thanks for taking the time. And I'll be posting doctor's links. I mean, his obviously podcast is going to come, YouTube is going to come early next year. That's this plan. So watch out for it. Might be helpful, especially if you're in a medical profession and you have similar thoughts of being frustrated. And I have met some doctors who have expressed frustration, but just they don't know what to do, right? So reach out to Dr. Stephen. Maybe he can help you get there with his journey. So anyway, again, thanks for taking the time, doctor.
You bet. Thank you so much for allowing me on your platform and taking the time to talk with me as well.
Thank you.